Hi, everyone, and welcome to another episode of the Healing with Coherence podcast series, founded by Radiant Life Technologies. My name is Michael, and I'm your host. And this is episode 10 of the series of Healing with Coherence, delving into the profound transformation of healing science, medicine, and healing technology that is taking place in the world today. You can find us on all major podcast platforms like Spotify or Apple Podcasts or Amazon Music. We are also on all social media platforms, mainly on Instagram and Facebook. And if you have not yet subscribed for any of our channels, I would like to invite you right now to become part of our community, and by that, to not miss any of our upcoming episodes. But you can also watch of some of the previous episodes on any of the platforms that I just mentioned. So please subscribe. It will be a huge support to our podcast as well. And if you like this or any other episode of Healing with Coherence, please share it among your contacts on your social media profiles. And this will also be a huge help for the further development of our podcast. All right, so I'm very happy to welcome our today's guest. This is Dr. Larry Wallace. Dr. Larry Wallace is a doctor of optometry, and he has a PhD in ocular phototherapy. He has practiced for over 48 years in Ithaca, New York. He is the founding member and served as a president as well of the International Light Association. And he's also served as a president and director of education of the College of Syntonic Optometry. And by the way, Syntonic Optometry will be amongst the main topics that we'll be talking today with Dr. Wallace, and also about his research and experience within the field of phototherapy, that he has conducted throughout his career. We'll be talking about his experience with neurology and light therapies, and basically in general about the therapeutic application of light and color. Because as Dr. Wallace calls himself a student of light, I got to know through him that actually light could be a very powerful tool to heal the eye and dysfunctional eyesight. We'll be talking with Dr. Wallace about his latest book, Reflections of Light and Vision. And so without any further ado, let's go to our discussion with Dr. Wallace. Dr. Wallace, hello. Welcome to the Healing with Coherence podcast.
Hello, Michael. Thank you very much for having me.
It's my pleasure, and I'm really looking forward to our conversation. Dr. Wallace, I would like to start with introducing the general public and our listeners to your discipline of expertise. Specifically, may I ask you please to explain what optometry is and what are the connected disciplines to that that you have been dealing with and working at?
Yes, optometry in the United States is a unique profession. It requires 8 years of college and training, and it's a licensed profession. And optometry is the basic vision provider in the United States. That is, we treat all vision problems, including eye diseases, but we do not do surgery. Otherwise, we treat any kind of condition. Optometry has its roots in everything from optics, physiology, biology, and psychology. And it is basically a science of vision and using different modalities to treat vision problems, which primarily involve lenses, like glasses and contact lenses, but also have subspecialties, of which vision therapy is a big one, and that's the one I've been involved with my whole career. I've been an optometrist now for 50 years and practicing Syntonics, which is a form of light therapy, for about over 48 years now, and I've treated thousands of patients putting light into their eyes to correct vision problems. So the field that we'll talk a lot about today is called syntonic optometry. Syntonics means to bring into balance, and that is to bring into balance the autonomic nervous system by putting specific colors or frequencies of light into the eyes to affect different brain centers, different physiological and psychological, emotional, metabolic changes inside the nervous system to support vision and treat a lot of vision problems that are created not from the eyes, but from imbalances in the body itself.
Okay, okay.
Um,
Uh, sorry to interrupt. I'm just curious how common optometry is today, or actually vision therapy that you are working or doing. Basically, how common is in healing people with eye problems, with sight problems?
Yes, well, optometry is the primary provider. There are more optometrists than ophthalmologists or medical eye doctors who specialize in treating eye disease. There's more optometrists in the United States, so they're the primary provider of vision care in the United States. The field of vision therapy is not that prevalent. Probably maybe less than probably 10% of the optometrists in the country provide vision therapy, and out of that 10%, maybe 2% are actually using light therapy as their primary modality of treatment.
Okay.
So it is, yeah, it's not mainstream.
All right. All right. Well, by actually reading your book, I understand that it's in fact a very effective therapy. And I'm wondering why it is not more widely spread.
That's a really good question that I've been trying to understand my whole career. Um, it's been around a long time. For instance, Syntonics has been, we have our 90th annual meeting this year. And that means we've been practicing the field of using light into the eyes, colored light, has been around for 90 years, and still most people don't even know about it. Um, the field of vision therapy has still been controversial. The medical establishment uses primarily surgery and drugs to treat vision problems, and there's a certain kind of structural approach that doesn't believe that vision can be improved, and it can be improved because there's a whole functional aspect. It's not all structure; it's function primarily, actually, and it's open to be changed. And there's different interventions that work, and vision therapy has been very successful, or it wouldn't have lasted. The vision therapy in general is like 100 years old, and it's been around all this time, and it's been growing every single year that I've been in practice, but never becoming mainstream. So you have to say, why is that? I think because people don't know about it. They don't know that there's alternatives. Many people think that the only alternatives is to do surgery or get glasses.
Okay, okay. Well, basically, like in many other fields as well, it seems to
Yes,
be the preferred approach, basically.
right, right.
Yeah. Dr. Wallace, how did it all start for you? How did you happen? How did it happen that you end up being an optometrist and syntonic doctor?
Well, optometry, I wanted to do a health profession. I looked into different professions like dentistry, podiatry, osteopathy, optometry, and I got into most of those schools. In fact, I think I got into all of them, but I decided optometry was very interesting to me because it involved perception, it involved psychology, it involved vision, it involved physics, which have been my favorite science. And so I was very lucky that I did do optometry because I think it's been the greatest profession that I could ever have had. Syntonics came later in time, not that much later, but in optometry school, I was very interested in psychology and behavior as it relates to vision. And even as a student, I studied the Bates system, which is an older system of doing eye exercises that involve kind of like yoga for your eyes. So these certain physical and mental exercises. I wrote a senior paper on it. As a student, I was involved in going to continuing education with something called the Optometric Extension Program that taught all about vision as behaviorally based, that you can train it. You can learn to change your vision throughout life. So I was very interested in vision therapy. I was also very interested in holistic approaches, interdisciplinary approaches to vision care and healthcare, and also very interested in prevention. I don't understand why people aren't talking about preventing vision problems.
Mm.
When I got out of school, one of the first places I worked was at Kaiser, a big HMO in San Francisco. I went to school in Boston, and I liked California. I went there with my wife, and I worked at Kaiser, and I thought that was a model of interdisciplinary healthcare, and I was very interested and very grateful that I got a job there right away as an optometrist. But I became disillusioned. I thought it was very based on production, seeing lots of patients. It was it wasn't what I thought it was going to be. It was more like I was just another cog in the wheel. And I met an optometrist named Ray Gottlieb, who had a holistic vision practice in Northern California, in Santa Rosa, California, north of San Francisco. And he was doing many different things. He had in his practice, he had nutrition, he had body workers, Feldenkrais, Alexander teachers, he had psychologists, he had um, a medical doctor. They were all seeing patients and working in a multidisciplinary way, which was always had been my dream. So I was very lucky. I met him, and he gave me a job right away because we thought alike. And he showed me this field of syntonics, which I had never heard of, and I was struck by it. I saw using colored light into the eyes. I was immediately mesmerized. That was it. I was said, this is just amazing. It makes so much sense. I mean, the eyes is the major way we process light, and not only images to see and things, but that it has these profound effects on all these different parts of our system. And so I began to study syntonics, and I've been doing that now for 48 years, and became very involved in it. I became the director of education for the College of Syntonic Optometry, which is the organization that teaches the field of syntonics. I was a former president there, and I've been education director for over 30 years, and I've studied and at great length. And I also was organizer of their annual conference in terms of getting teachers, and that's part of the book. I brought in teachers from all over the world to teach us about light, to understand how could light and color have such profound effects on our health, and trying to understand it at a deeper level. So in the years of bringing all these teachers, all these researchers, therapists, doctors, people who were around in the field, I had a unique experience in the field, and that's part of what the book was about. A big part of the book was about.
Yeah, well, this sounds amazing, and I've been wondering while I was listening to you. Obviously, you say that the first time you got in touch with Syntonics, you were mesmerized by the idea of healing the eyes with light and color. What were the most, let's say, eye-opening moments then after that in your career that were confirming that this was the right choice for you, but that you were confirming as well that Syntonics is really something that is effective and it should be promoted and it should be applied and used for healing the eye?
Yes, well, that was right at the beginning. We in the practice where I was working, we were treating every patient along with exercises, or even things like jumping on a trampoline and using their vision and their body together. We were giving them frequencies of light syntonic therapy on a regular basis, sometimes 3 times a week in that practice. And there are certain things that happen in the nervous system that the syntonic therapy creates that I have never seen before. One of which is people, when they have vision problems, their peripheral vision shrinks, and they start losing sensitivity in their peripheral vision. And sometimes they have very tiny, little tiny fields of vision. It's like the size of a dime or a quarter. And you would give them this light therapy, and within 2 weeks, 3 weeks, the fields would completely open up. And when their fields would open up, their vision skills improved, but all kinds of changes in their behavior, in their emotional state. It was like they were opening up the world, and it was happening so quickly that I knew that it was the color that was doing it. We'd never seen anything like that in my ever in school or clinics or any other any other time with any other therapy that made it happen so quickly. So it became like an essential part of all the vision therapy that I've ever done for all these years.
Amazing, amazing. Well, I've been just an idea came basically because you say when you fix somebody's eyes or sight, they start to behave in a different way, perceive the way the world in a different way, which actually sounds absolutely logical, because if this is one of our main senses through which we are perceiving the world, and we are creating our picture of the world, and it's said that actually there are no two people that see the world in the same way. I can imagine how people that actually have dysfunctional eyes, how impaired they are in terms of perceiving their reality in a certain way, and that's amazing.
So yeah, I mean, one of the major areas, although we treat people with all ages, let's say from infants all the way up until they're 100 years old, um, is that especially with young people, they have trouble reading, they have trouble remembering what they read, they have visual processing problems, and then that can evolve into other behaviors such as attention deficit or depression, lots of different ways that the students react when they can't do well in their schoolwork. And basically, when you're reading, most of the information, there's an auditory component, obviously, but there's a huge vision component that's basically neglected. And so the vision, the ability to remember what you see and to visualize, your visual memory depends on your vision skills. So it has very huge applications in with kids who have visually related learning problems, but also in other fields. Another big field is sports medicine. Athletes have to have good vision. They have to be able to see around them. They have to be able to have quick reaction times to what they're looking at. And those can all be improved. So that was a whole other field. In fact, I actually worked with the basketball teams in terms of their improving their ability to process the information around them. And that was very successful here in the place where I live. So it has applicability in all kinds of different ways. And the vision is so profound, as you say, it's so big. People don't even understand the implications of when the vision isn't working well, how it can affect all different aspects of their life.
Absolutely. Sports got my attention because I'm an athlete, all life athlete myself. I'm a gymnast, so I'm still using the trampoline. And you mentioned the trampoline, and I'm really curious to understand a little bit more. So, what was that exercise that you were doing with the trampoline, and how it is connected with improving the eyesight?
Yes. Well, so what the trampoline work does is we would have a person on the trampoline, and they have to, first of all, they have to establish a rhythm and timing, which is they practice a certain kind of rhythmic timing. And then we will have them do visual tasks and auditory tasks while they're maintaining the control of their body while they're jumping. For instance, like we might put words on a board, on a whiteboard or blackboard, and we'll have them bounce and say each letter, and we'll have them do clapping on alternate letters. Then we may turn them around and have them not facing the colors and have to remember what they just saw. And again, do certain things on certain letters, take two bounces or clap their hands or turn to the sides, turn right or left. And at the same time, then we might make it harder. And then the next step is we start doing every other bounce, say the letters backwards on the word. And we could use colors, we can use all different kinds of visual cues in which to train their attention. So it's called an attention memory training. You have to remember what you're seeing. First you have to pay attention, and what happens is you become frustrated, and when you do, you start losing what we call self-direction. You lose your rhythms, you can't continue to bounce properly, or you just get mixed up with what you're doing. And that frustration level is then you go back and you keep doing it until they overcome that frustration level. And what it does is it builds the ability to attend for longer periods of time, to see what you're looking at, and clear your mind, because you can't be thinking of other things while you're doing all this. So it makes you pay attention to the visual tasks, the auditory tasks, the motor tasks. And as you integrate the auditory, because you're going to speak out letters, you're going to have to remember them, you're going to have to give directions, and they're going to have to repeat them and do them. You're integrating the rhythm of the body, the movement of the body, the mind, the emotions, because it's frustration, and the mental aspects of training attention and memory. So the trampoline is a great tool because it involves the whole body. You also things people use walking boards, balance boards, just walking in different directions while they're having to do visual tests. But the trampoline is great because it brings the whole body into it. And
Amazing.
immediately you overcome your frustration. You begin to be able to take more stress and recover. And how quickly can you recover when you start to lose your concentration, which is going to happen? We keep testing you, and then till you can actually go to a higher and higher level of processing. It can be very complex, the tasks that you can start to on your bouncing.
Okay, okay. Well, I'm myself a big promoter of movement and movement longevity, and I see movement and like whole body movement and exercising as a way to improve all your body systems. So what you're saying just confirms that even think like your eyesight, which somebody can actually think it is largely disconnected from how your body as a whole moves, is very actually closely connected, because actually what I understood from your book as well, I've known that before, but actually it was a very a good reminder that the eyes are connected through nerves actually to the shoulder muscles, and your posture is connected to your eyesight and so on. I was amazed to read that in your book.
Yeah, absolutely. So there's two things that just came to mind. One is that often we define eyesight as the main part of vision, but the other parts of vision, eyesight is what is it called acuity, the ability to see detail, either far or near. But there's also the aspects of depth perception, the aspects of peripheral vision, the ability to move the eyes in all different directions freely because people have restricted eye movements. You have depth perception depends on eye coordination, how well the eyes work as a binocular system. That is, the brain processes each eye, puts it together, and the information is greater than if it was for one eye. The two eyes sum up and make more information. And also, the eyes, as you were saying, are connected to the neck, the cervical area. They're connected to the inner ear. Every time you move your head, your fluid in your ear moves in the same as different canals that move exactly linked to the eye movements. And same with the neck. Every time you turn your eyes, your neck is supporting it. So problems with posture result that can result in eye problems. Eye problems can affect posture in cervical areas. And then when the eyes aren't connected to the vestibular, the canals, because the eyes are looking one way and the canal fluids are moving another way, you get dizzy, you get lightheaded, it affects balance. So that also leads to two things. One is that we break down the vision skills. We test and analyze the peripheral vision, the focusing, looking near to far, far to near. Muscles push on a lens in your eye and shape the eye to make the light focus for different distances. Eye movements, eye coordination, peripheral vision, posture, because you look at the how the posture is in the head and neck relationship. If they have neck tension, obviously dizziness and vertigo and balance problems, we always have to investigate the eyes as one part of it. And in addition to that, we work with other professions. I refer to a physical therapist who specialize in cranial problems in the skull, also in the neck, the balance system. We work with osteopaths, work with all kinds of nutrition. The eye requires huge amounts of oxygen and nutrition. It's the richest end organ in the body in terms of blood supply. So your eyes require a lot of energy to be all the time. They require huge amounts of energy. So it involves all these other things. So through the years, I've worked very closely with other professions. In fact, at one point, we had two physical therapists working in the office.
Okay, okay. You want to grab a glass of water? Ah, you have a water. Okay.
Okay, good.
That's all right. Yeah, sure. Drink water. uh, well, that's all amazing. And I've been wondering. is there a can you summarize what are the most common causes of eye dysfunction today, or basically hurting the eye? Obviously, I can guess one of them is like looking at mobile phones, but like in
Sure.
general, what are the other causes,
Well,
the
I think
general
the
causes?
biggest there's 2 factors. I mean, the biggest one is the near point stress. There's so many near center tasks. Your eyes didn't evolve to be sitting looking at a foot or two away from you, 8, 10 hours a day. And so sitting in front of computers, using the phone, all that is putting a lot of stress on the vision system. It's not meant to be looking at near all day long like that. So that changes actually it makes changes in the actual structure of the eye. It breaks down the coordination, the focusing. You have dry eye because the eyes aren't being lubricated. All kinds of things result in the stress that we put on ourselves, our body. It's not just our eyes, our body, from all the way we spend so many hours a day looking at close things. And I think that's the biggest thing. Another aspect, of course, which I've been interested in, of course, is light and lighting. There's light pollution. There's all kinds of bad lighting that puts stress on your nervous system. It changes the energetic metabolism of your eyes. So I think there's all kinds of environmental stresses, and of course there's emotional stresses and mental stresses. So they all take their toll on the vision system. So it's really the age we live in. And so unfortunately, nearsightedness, which means your eyes are focused at near, even when you look far away, the eye actually focuses the light as if you're looking at near things, even when you look far away. Um, is growing like huge. It's an
Mm,
epidemic. There's more nearsightedness now in the population. I think it's well over 50%. And in other places, it's even 60% of the population is becoming nearsighted. So not only does that result in things like needing glasses to see far away or whatever, but it also creates a lot of stress on the eyes themselves. It compromises the eye circulation. It leads to things like glaucoma, which is high. That's an eye disease where the pressure of the eye rises, and or the eye stretches, and you can have retinal problems, and you have cataracts at much earlier ages. So there's all kinds of physical things that are happening to the eyes and functional things as well because of the age we live in. I think that's the
right.
biggest thing. And again, it's all near-centered things and bad lighting, bad food, all of that.
Well, I've been talking to people from different areas of life, and always connecting the discussions to health. And it seems like the environment we live in is actually putting a lot of stress and restrictions on our bodies as a whole, because as
Yes,
as, as human beings, we are not designed to live within restricted environment as the one that we've created. The way how we sit, the way how we sleep, the way how we go throughout the day. And especially with the eyesight, while living in a city, you don't have much space, even like even in the even more in the bigger cities, you don't have much space to look far away. So I
right.
can imagine this impairs the eyesight massively.
Yes. Yeah, for sure. Yeah. And that's why it's important when you do near work to look away frequently. They have a rule like the 20-20-20 rule. Every 20 minutes, you look away and you blink and you breathe and look into the distance for 20 seconds. And then you get up and stretch. And you need to do these kinds of hygiene interventions to reduce the kind of stress that we're putting on. But like you say, movement is so important. I mean, we need to get up and walk and move and participate in activities
Mm.
to balance out all this sedentary lifestyle
I
because we're not
remember.
getting healthier.
Yeah, absolutely, absolutely. I remember that story. I cannot remember where I read it, but it was about healing the eyes, short-sightedness, and it was about the person who went. I don't know if somebody recommended that, or they were told to do it, but he went to like Chinese monastery, or Himalayan monastery, and basically what he was
Mhm.
asked to do is to carry all day. The monastery was on a hill, and they asked him to carry buckets with water all day, just holding the buckets on both sides of his body with strengthened hands, and to go up to the hill and smile and do that for 6 hours a day. And apparently, after I don't know how long, like 3 months, for example, doing that, he was very like already very improved very much in strength and everything. But his eyesight improved. I cannot remember
Right.
what was that story where I read it, but it makes so much sense. From what you're saying. First of all, like cheering up because they ask him to smile all the day, then doing this physical work and exercises. And basically, I imagine that as well, going up to the hill and looking into your object, which is up there. The monastery was about changing your eyesight from short sight to far sight, right?
Right, right. Yeah, I can imagine such a thing very easily. Yeah, that's a good story. Very nice. Yeah.
Yeah. Dr. Wallace, who were your teachers and people who inspired you along your way, who you learned from?
Well, I think the biggest, first of all, working with Dr. Ray Gottlieb, he was my first mentor and showed me all these other ways to approach vision problems. And I've been close friends with him now for like 48 years. And so we just spoke the other day. So he's been an inspiration. He's also been he's the dean of the College of Syntonic Optometry, and he has constantly looked at research papers and presented the latest research in the field of light and light therapies and also treating vision problems. He was a huge proponent of the Bates system, using deep relaxation to the eyes, realizing that a lot of the Bates said that most of our vision problems were due to strain, mental strain, and so he devised all these exercises and techniques to make us aware of our strain and retrain them, and so Dr. Gottlieb has been a very big influence. And Dr. Riley Spittler, he's the one that created Syntonics. He was a medical doctor. He was also a physical therapist, a naturopath, and he was a medical optometrist. He was also, again, a physical therapist and a nutritionist. And he loved optometry, and he chose optometry of all the professions that he had degrees in. And he's the one that did 17 years of research drawing physics, physiology, biology, psychology to create the science of syntonics. And that's been a huge inspiration. And to me, I've read his books, his teachings many, many times. And there's always stuff more to learn. And that's been one of the most exciting parts of this field is there's always more to learn. And so it's lifelong learning. And so I've been very interested in the whole field of light. And so as time went on, I reached out into other areas besides the College of Syntonics. I was involved in something called the International Light Association. I was a founding member. I've been formerly a president of that as well. And that brought in disciplines from all over the world, people using light and color to treat every kind of condition you can imagine. So I was inspired for part of my career by having exposure to all these different people. And so there were many people that I learned from. But I think most of it was I think that those two, Riley Spittler and Dr. Spittler, and there was another doctor named Dr. Charles Butts. He was one of my mentors in terms of the field of learning about syntonics, and I became his prime student, and later I took over his work as the education director of the college. And he was a big inspiration. He treated probably thousands of people with light, and he had so many successful cases. And so it's been a lifelong learning process, and I've been very grateful to have this to be part of my life.
Great. Sounds great. Going back to your book, how would you summarize, let's say, the core message that you've been trying to deliver through the book?
Well, part of it was the book has been published by something called the Optometric Extension Program, which is basically the primary one of the primary educators of optometry. So part of I basically chose them to publish the books because I would reach many, I think thousands of optometrists. And I think the message is that there are many other modalities, especially which is light, that they aren't paying attention to. There's many vision therapists, they do mostly exercises and visual motor training, but they don't, it just amazes me that they don't know about light. And that was really the major thing. I wanted to stimulate more interest in my field in the subject of light therapy. And also electromagnetic therapies. I've been involved in something called microcurrent therapy, which is basically an offshoot of the light therapy. Basically, I found that with certain eye diseases like macular degeneration and retinitis pigmentosa, we treated them with light, and we found that there was no treatment for those conditions. There was nothing they could do, and in medicine or anything else. And we found that they improved. Their vision got better. It actually improved them. And light therapy basically is really high frequency, very high frequencies of energy. So I thought, well, what if we use lower frequencies, more attuned to the physical body? And that would be like, instead of thousands and thousands of cycles per second of energy, bring it down to 40 or 50 or even 100 or 200 milli microcurrent of amperage, very low levels of electrical current, frequencies of very low frequencies that are more physical. So what we did is I invented a device, a microcurrent device. In fact, it was the first microcurrent device that was patented in the United States to treat retinal disease. And we treated, myself and an engineer, we created an instrument where we put electromagnetic energy into the eye. And we had very good success. And it was, we got a patent, and we did research, and other companies took our technology and have been working on it ever since. So I was interested in electromagnetic energies in general, and that's that our body's more bioelectrical than it is biochemical, and that the physics aspect of our physiology and our biology is actually supersedes the chemistry. The chemistry is really directed by the energy and information from more the electromagnetics that basically are the main energy forces that we live with in human existence, basically.
So is that the main principle how the light therapy and the device that you mentioned actually works?
Well, it stimulated me, yeah, that I saw that light could do it on this high frequency. What if we use low frequencies of electromagnetic energy? Because light is electromagnetic energy. It's in the visible spectrum, but there are also electrical energies. The visible spectrum is just one small part of the electromagnetic fields and energy that we're exposed to. So if we slowed it down and use it more on a physical level, like small levels of electricity at very low frequencies, like 40 cycles per second, 100, 200 per cycles, instead of like thousands and thousands of cycles, that we would see what happens. And I thought it would, and it did. It had very profound effects on eye disease, reducing inflammation, increasing circulation, reducing scar tissue, increasing the metabolism, and actually stimulating something called the mitochondria in the cells, which light therapy can do now. And that's a whole new field called photobiomodulation, where we're using cool lasers to also do the same thing that the microcurrent was doing. And that's a whole other field that I'm very interested in, and I teach lectures in it.
Okay. Well, that's an interesting field, of course, because it's we are in the Healing with Coherence podcast, and Healing with Coherence is also another word for coMra therapy. And I know that you've been using coMra therapy as well. May I just ask you to what extent you've been experienced with coMra therapy, and how you have experienced actually the work with coMra therapy?
Yeah, coMra therapy is using coherent multi-radiance applications, and what the device, when I first saw it, I was searching for a cool laser because we were using what's called focalized light. That is not light just generally in the eye, but actually putting small beams of colored light into different parts of the eye muscles and things like that, and on the macular area. Saw that its effects were similar to the microcurrent and even easier to apply. I was looking for a laser, and I came upon on the website this laser that had multi-radiances. It had infrared light, it had colored light of three different basic colors. It had pulse magnetic fields, which was electromagnetic, basically reinforcing the depth of the energy, and ultrasound. And I was amazed to find this device. And I had worked in a healing group that involved physical therapy, um, using different kinds of uh, basically gemstones and minerals that were put on the body, and playing, and also sound. We were using different musical sounds produced by one of the participants in my light therapy, and we had these profound effects on people. And here I saw this device that had all these energies built into one device. So I was immediately intrigued. I contacted them. I bought the device. I started communicating with them very closely, and with Garrett and Arzan, who was their scientific director from, he's in Russia now. And I had them come and speak at our conference, probably two or three times. And so we used the device in the office. We've used it to treat basically brain injuries, injuries that where there's been strokes, where there's bleeds in the head. We put that on. We've used a laser, and we found that the people who have eye problems, like their eyes turn in or not coordinated because of paralysis to the nerves, to the to eye muscles, we could reverse those conditions. And so the Delta laser has been, we've used it for all different kinds of eye conditions, mostly eye diseases, and or try to treat eye muscle paralysis with it. And it's been super helpful. It's been an amazing device.
Great to hear that. Uh, Talking about coherence, one of the questions I've been asking my guests is to just kind of try to explain to me how they see coherence, the importance of coherence, or to explain what coherence is within the frames of their particular field of reference.
Mhm.
What would be coherence of the eye, let's say, or of the eyesight?
Well, I would think I would approach it more neurologically. I think that we would be looking to bring in, well, it's not just neurologically, but we would apply the light in it from a neurological standpoint to try to balance the nervous system. The nervous system, there's two basic branches of the nervous system, and the autonomic part that directs all of our, you know, directs all of our involuntary biochemical and energetic processes in our whole body. And there's the sympathetic and parasympathetic. The sympathetic speeds things up, and parasympathetic relaxes us and controls lots of all the muscles of the eyes and all kinds of physiological functions. And so what we're looking for is to bring coherence between, or balance between, the two branches of the autonomic nervous system. So the coherence is that they're not equal, but they're interfacing each other in a way that is, where I would define coherence, that would be that they're working together to balance our system, not only within ourselves, but with the environment around us. So there's a coherence between what's going on inside of us and what's going on, all the stimuli coming from the environment, also all the internal stimuli, all the myriad of millions and billions of reactions that are going in our body, that when they're brought into coherence, they're brought into a state of a balance, you could call it balance, but not equal, but they're working together to make us function at the highest level and the most efficient, energetic level and the healthiest level. So coherence is also a synonymous with health and wellness. The more coherence we have in our system relative inside, outside, in the interaction of the two, the healthier we go. And there's many different ways to approach this kind of goal of this balancing and this wellness within us.
I would even say that like my perception, my feeling is that coherence is the most natural state of our organism, right? Which
Yes,
actually is
yes,
something that's the aim to reachieve, to reestablish the coherence in the original state of coherence in the
right,
body.
Right, and so obviously there's so many things that break down our coherence. So we
Yeah.
wanna do that's what healing is about. Healing is bringing us back into the natural state. Our bodies have all the power to heal us in every way, but they lose that effectiveness when the coherence is lost and we're being
This
driven in one
reminds
direction.
me, yeah, so sorry, yeah, exactly, exactly. And this reminds me a note I made here from your next excerpt from your book, which says that it's a common belief. I'll read through that retractive errors such as myopia, hyperopia, and astigmatism are not amenable to treatment. And you are suggesting in your book that they are. And I remember I just recently spoke to someone about one of I think it was myopia, and I told him, well, have you tried actually something like eye yoga or training your eyes, try eyes movement? And he laughed at me and he said, yeah, this will improve my eyesight, right? So it is not commonly accepted actually, but can you talk a little bit more about that? So because I have myself a slight astigmatism, and I was prescribed googles and eyeglasses, and basically I haven't thought about the possibility of somehow uh, revising that. So how that works, what I can do, for example, for the astigmatism.
Well, at a physical, there's a certain the mental emotional state which you can use the Bates system to try to relax all the muscles. The idea of astigmatism is the eye has got an irregular shape. It's kind of a shape like a football. It's got a horizontal curvature to it than different than the vertical, and so the light horizontally focuses in the eye in a different place than the light coming in the vertical meridian. So there's two focuses, and your glasses would have power up and down and across or at different angles to correct that misalignment. But the cause of it is often behavioral. That is, there's emotional aspects as a whole. That's a whole field of what kind of thinking you have and kind of emotional conflicts you have that could create a mix up in mixed messages in a sense. That's a whole field in itself. But on a physical level, that there's muscles, 6 muscles around the eye that are putting tension on the eye, and so um, what one does is, besides relaxing those muscles, is in a light therapy application, we would actually, there's these 6 muscles around your eyes. We would put colored light. We would test each muscle. We have a way of testing the range and strength of each muscle of the eye to see whether it's overactive or underactive. And if it's overactive, we would put, let's say, blue light, which relaxes the muscles, on a point in the eye where that muscle is. And we might put red on the other eye where the action is underactive. So we can relax one muscle and stimulate another muscle to try to reshape the eye. And that's one way to deal with astigmatism. And that's been something I've been very interested in. We've had, but once it gets embedded in the structure, it's hard to change it. It's not easy. That's why it's better to prevent it. So part of the prevention is not to be looking at things at different angles. If you're always looking off to the side, and then you're trying to read, your eye starts distorting its shape because it's looking at everything at an angle. And different parts of the space is angular. So we want things directly in front of you. So there's habitual things we try to teach people in terms of hygiene. Um, Another aspect to it is, besides relaxing it, is to again to try to affect the eye muscles themselves. And another component can be there's that the muscles insert to certain bones in your head, and the bones are out of alignment. If you had a head injury or you've had bad posture, and somehow the 5 of the muscles go into what's called the sphenoid bone, right in the beginning of your skull. And if the sphenoid is out of adjustment, the muscles are pulled in different directions, which then distort the eye. So the way that's dealt with is through kinds of cranial adjustments to try to get the bones of the head aligned. And there are experts called craniosteopathy or sacrocranial therapy that can work on realigning the muscles of your head, which could get out of alignment from bad posture, bad habits, or some kind of injury. And so there's a lot of components to it. Nothing is real simple, but those are the things I would look for. I would look to see, if you've had the astigmatism for many years, you start reducing the prescription. That would be one thing we do. And we try to modify the eyeglass prescription to become, to reduce the astigmatism by lessening the correction for it or angling it at different angles to try to get the eye to reshape itself.
Okay.
So there's a
Yeah,
lot of things.
I haven't been using the glasses much. I mean, they were recommended to me for driving and watching TV. I'm not using them for driving because really I don't feel any impairment actually when I'm driving. When I'm watching TV, sometimes I don't know, when I'm watching football, and I in order to see more clearly, I would take them off, take them on, or
Right.
basically if I'm watching something with subtitles. But I'm trying actually not to get my eyes used to the glasses.
Right. So there is an element of that. The more you wear it, the more dependent you are on the prescription. But at the same time, we have people that go the opposite way, and they don't wear their prescription because they think it's going to make them worse. But it really, I haven't found that it makes you worse. It makes you more dependent, but it doesn't make you worse. And so, at certain points, I would say it's better to see clearly than to try to not see clearly because you think it's going to make you better. It doesn't really work that way. And I worked, with these systems. As okay, take your glasses off and see. I worked for years with those systems, and we had improvements, but I found that the longer you've been wearing it, the longer you've had this condition, the harder it is to reverse it. And then the question is it worth the energy to avoid wearing them and not seeing well? So that's, but it is good. It does, what you're doing is really good. I mean, you're not dependent, but it's good to use them, and it's not that bad a thing. So
Yeah, sure,
it would,
absolutely. I'm not refusing at
yes.
all, but I'm just saying that I don't feel I need them for that much of activities that I do.
Yeah, so that's a really important point. So what we try to teach people is that they don't need their glasses all the time. In fact, part of what the glasses do is make you focus on detail. So going without them, you have to be more peripheral. So you have to be more looking broadly at your space around you and not at the details. And that's what people need. They need to go outside. Let's say if they're in computers, take their glasses off and walk around and don't look at any details. Try to take in the big space around you and be peripheral. And so, not wearing them can have really all that the benefit of actually helping reduce a lot of stress on their eyes, and not having to be focused on the detail of everything.
Mm-hmm. Dr. Wallace, I got really intrigued by hearing from you that you see as well the connections of eyesight to emotions or to impairment and dysfunction. So how is that connected? And what are the emotions that you recognize in connection to the different eyesight dysfunctions?
Yeah, I think that I think that there are definitely emotions. It seems to be, for instance, fear is a big emotion associated with nearsightedness. Um, trying to shut down the world and take away the things that I'm afraid of and be focused on, and your eyes become more centered and more focused on detail and give up seeing distance. Uh, Farsightedness, hyperopia, it's called, where the eye focuses at far but doesn't really focus well at near. Those tend to be people that are emotionally maybe more angry and they have to act out things. And stigmatism has been associated with people who have conflicting emotions, that they're caught between conflicting situations that they can't resolve. And their eye is a reflection of those kinds of emotions. So there's definitely an underlying emotional component. My wife is a homeopath, and when she was working in practice, she found, and she was also a vision therapist, and she saw a real strong link between all these different conditions and emotions that she would be working with as a homeopath. So there's definitely an emotional component to a lot of our vision problems. Um, so it's everything is tied together, as you know. So there's the physical body stresses, the eye stresses, the environment, the emotional states that we're in. So that's definitely a way. And some people have had. There's a Dr. Jacob Lieberman who works a lot with emotions and vision problems, he uses color a lot. He trains people to he finds different colors that allow them to face or react to, and he finds the emotional basis of their reactions, and then ties it to their vision problems. It has a lot of had success with correcting people's vision, just working on that plane alone. The emotional, using color to experience your reactions to the color, which also tells you something about the emotional state, which also tells you about the way their eyes have developed, their problems. And as people release these emotions, sometimes they have big improvements in their vision where they can see much better without their glasses and such, so forth.
Okay, well, it makes much sense to me because I'm thought to use and to seek for the emotional causes of diseases, and that's how I've been working with my own physical health problems for a long part of my life. I haven't particularly thought about the reasons behind the eyesight dysfunction, so that's like eye-opening for me. When you say about the astigmatism, for example, this confusion, or how did you call it, the
conflicting conflicts in resolving certain
absolutely, I can relate to that. I can relate to situations, like prevailing situations in my life, to which I can connect this state. So it's really interesting to look at that, and probably try to look into that more deeper, and see how I can use that insight to try
yeah, so
help myself.
Lieberman's books are good. I would suggest reading one of his books. Also, another man named Rocky Kaplan. He wrote books on improving vision. He was very much into the emotional aspects as well. So,
Okay.
yeah, Rocky Kaplan and Jacob Lieberman. I also wanted to say that a huge part of our practice is a head injury, and that's been a major thing. Both injury that's from strokes and heart attacks, but also head injuries from accidents, which are huge. There's so many people have had head injuries. Head injuries almost always affect the visual system. It throws off the autonomic nervous system. They're in a state of fight or flight. They can't focus. Their pupils won't respond to light normally. They'll have all kinds of symptoms. They'll have anger or depression. Depends on what stage they're at. And so head injury rehabilitation, it's called neurooptometric, neurooptometry, and there's an organization, Neurooptometric Rehab Association, that trains optometrists in treating all kinds of trauma. And that's been a very fast growing field in optometry. Yesterday I saw 2 concussions patients with all kinds of visual and emotional problems. And so that's an aspect where the light therapy has been tremendously helpful, and in terms of rebalancing the nervous system, which gets all out of whack whenever you have a head injury. You either become overly stimulated or you move on to a stage of depression and anger and withdrawal. So that's been a huge aspect of our practice now, and very rewarding, because these people are not getting help. And of course, then we refer to other people as well, especially to the cranial specialists and the physical therapists, chiropractors, etc.
So
So
that's what I wanted to ask you, actually. Who are the specialists in the different areas that would work on a particular case? And you just mentioned them, right?
yeah, well, often they see a neurologist first, and they have all these different symptoms and things from injuries or chronic diseases like Parkinson's or even Alzheimer's. And then they get referred to some practice like ours that I work in. And we work a lot with nutritionists, chiropractors, and osteopaths and physical therapists the most. And mostly the physical therapists, I would say, is number one, because they do all the different physical aspects of the body and system. And we have one in particular. His name is Michael Najelski. Najelski he's nearby. He's a PhD, a super tremendous physical therapist, and he was in our office for some time. So was another physical therapist who was trained in postural restoration rehabilitation, and I think working with them has been probably the most common thing. But also sending to chiropractors and nutrition, and nutrition is super important. And I'd say those are the most common ones that we're working with, and that's been and it's necessary to work as a team. The more you bring in, the more facets that you can address in a person's condition, visual condition, or whatever. To me, that's the most effective way, and that's why the holistic health movement has been so important in my mind and in my practice in my life. And interdisciplinary approaches are just absolutely necessary to have the best results of all.
Yeah, this sounds really inspiring. That there is a whole team working together and everybody is bringing their specialty, let's say, and that's as well like the effect of coherence in terms of cooperation, right, of the team.
Right, absolutely. Yeah,
Yeah,
yeah, no one person can do everything. No one therapy can do everything.
yeah, yeah.
But
Uh,
light therapy is really important, and I guess that was the biggest part of the book is to stimulate people's thought about how the power of light and what that aspect of healing is should be more incorporated. And then it
yeah.
is. It's growing. It's growing because of the photobiomodulation field, where they're using cool lasers now to treat every kind of condition. And so the field is exploding right now. And
Like my own experience, and it's really just based on my perception. I obviously have the coMra device at home, and whenever I feel that my eyesight just purely like sitting and watching TV, and I feel that that's connected to the eyeglasses as well. I feel that I need to bring on my eyeglasses, and this is going for a couple of days because I just feel that my eyesight is weaker. In the moment that I take the coMra device and I treat my eyes for, I don't know, 10-15 minutes,
you put
I
it
I
right on your
just I feel it.
put it right on your
Yeah,
closed eye.
yeah. I through the close,
Right,
yeah, and through a side angle, of course,
right.
and I feel my eyes refreshed, and basically I just feel that I not that I see perfectly, but I really see the eyesight refreshed.
Right.
Obviously, the astigmatism is not healed because I haven't focused on that, but I just feel my eyesight refreshed.
And it does, because what the light does is it gives energy. It stimulates the mitochondria and all the cells to produce ATP to up the energy to all the muscles, the nerves, everything is being revitalized by the light. Light has that power. And light has a power to well, we could go into a whole other field of what it does in water. I mean, water, your whole body's water, and water has a maximum absorption of light when the water structures itself. And I'm sure you've had probably talks about that in the past. And so, yeah, you can revitalize yourself with a treatment like that. And it's very good. We have people use their home device called the Palm, and they have it at home, and we have them use it for different conditions. And
Perfect.
like say about 5 minutes, right? Very
Dr.
good.
Wallace, how about prevention? You mentioned prevention. What would be the prevention that you would recommend to the listeners to keep their
Early
eyesight healthy?
early exams. We can see a vision problem coming probably about a year in advance. We can see breakdowns in coordination of the eyes or focusing efficiency or some kind of constriction in their perceptual fields or their peripheral vision that's going to result in structural changes. So what we do if we get people younger, the younger we can see them, the better more you can prevent these problems. And interestingly, one of the ways to prevent myopia is to prescribe very weak reading glasses when you're doing all these near center tests to reduce the demand on their focusing and reduce the stress of having to look at something. So wearing these very weak reading lenses can prevent myopia, and I've seen it over and over again. People that have used them, they never get nearsighted, and they wear them for maybe even a few years, and then they don't wear them anymore. And they may wear them into high school and then not wear them just for reading, and that can take away the stress. So, I mean, that's one of the things. The other things, you can do hygiene, you can teach good habits, good lighting, good posture, using good breathing, all the different things you can do to reduce the stresses that are there. So the most important thing is to do things early, and not to wait till it's all embedded in the structure. You try to address the functional and behavioral aspects early on.
Okay. Okay.
Or as an adult, when you're turned 40, let's say you're starting to lose your focusing, well, give them a little help up close so they don't develop nearsightedness. A lot of people get nearsighted or astigmatism when they're in their 40s because they're resisting. They figure they don't want to wear reading glasses; they'll become dependent on them. The key to that is to give very weak reading glasses, just enough to release stress in the system, not to become dependent on the power of the lens. And so just look at you have to be examined to see where the functional stresses are and then address them early on. So I think,
Okay.
again, my standpoint, early detection is the most important, and teaching good skills, good like hygiene at the computer, how to set it up, what angles to look at, um, what kind of habits to do. So, environmental behavioral education is real important in prevention.
I see. I see. Perfect. Dr. Wallace, how do you see the future of the healing the eye and the optometry and
Oh, I think it's a double-edged. I mean, one way we're developing more therapies than ever, and understanding more aspects, and treating at a deeper level. But at the same time, the environmental stresses are pushing us to get worse. So you've got more tools. There's constantly evolution in therapies. There's newer devices that are more efficient, that require less application for, let's say, in terms of energy. Electromagnetic energies like microcurrent is now becoming very big, and using cool lasers, using syntonics, using exercises. All these things are getting better. There's newer ways to train the visual skills than ever before. But at the same time, you've got more environmental stresses and poor health. And we're getting sicker as a country here. I mean, our nutrition's terrible. We have enormous pollution problems, in the air and everything else. So who knows? We just keep at it. But uh, the therapies will get better, but at the same time, until we change our lives in certain ways, it's going to we'll just be fighting away at it.
right, right. Well, I've been noticing that there is a growing interest in red light therapy in overall to keep basically the whole body healthy and so on. And for
Right.
me, like red light therapy is really the predecessor of the modern technologies which are available today. So I'm just laughing how people at once, they pretend to have discovered something completely new and exciting, but
Right.
it's actually already an old technology, and there are much more modern technologies. But it's a good site that actually humanity is opening up
Yes.
to that side of healing and technology.
Yes, I agree with you completely. Yeah.
So I hope that also the future of syntonics is bright, and that more people will be really using syntonics for healing the
Well,
eye.
yeah, that's been true. Our membership keeps growing. We have optometrists now, having branches of our work now all over the world, in Asia, and the South Pacific and India, and of course all through Europe. Um, Worldwide now, it's becoming, the field of syntonics is growing and growing, and we have, say, members and people interested now, from all over the world. So yeah, it's definitely growing, and it's all part of the exciting field. For me, it's super rewarding to see all this happening.
Great, great. Well, Dr. Wallace, thank you so much. It's been really a pleasure to discuss all that with you.
Yes,
Uh,
Cal, thank you for having me. It's a pleasure talking with you.
yeah, I really feel I learned quite a lot. I feel inspired. That's always a good sign. when towards the end of the podcast. So thank you so much. And
Yeah, thank you for what you're doing. Thanks for what you're doing and educating people. It's wonderful. So really appreciate it.
thank you so much. Okay, so with this, I would say goodbye to our listeners as well, and we'll see each other in the next episode with our next guest. Dr. Larry Wallace was our guest today. Dr. Wallace, one more time, thank you so much. Good luck with your future plans, and I hope to see you soon again.
Yes, thank you, Mikhail. Me too. All the best.
Thank you. Dear listeners and viewers, thank you so much for staying with us till the end of this episode of Healing with Coherence with our guest, Dr. Larry Wallace. Please, if you have not subscribed yet for our channels, do that right now because this is a huge support to the further development of our podcast. And I will be very happy as well if you share this episode or any other episode of our series that you liked amongst your contacts on your social media networks. Thank you for being with us. I'll be looking forward to seeing you very soon with our next guest. Till now, or till then, be well. Bye bye. I wish you a wonderful day and a lot of health. See you soon. Bye bye.